Thank you, Dr. Partha. Uh, I'm adult physician and working for type 1 for past 20 years. Again, there is big story behind it. When I started my diabetic clinic 20 years back, one lady came with little girl, 11-year child, vomiting and perspiration and respiratory distress. And I told that I'm not a pediatrician. I'm physician, so I don't see the children. She told she's diabetic. I look her. She was in very poor shape. So मैंने कहा शुगर की जांच कब करी थी कि 3 महीने पे क्या करते हो आपके सर मैं पीछे वाले घर जो घरों में झाड़ू पोछा करती हूँ हस्बैंड वो सब मजदूरी करते हैं लेबर एंड और वन मोर चाइल्ड इज देयर ही इज मेंटली रिटार्डेड एंड आई एम अर्निंग माय हस्बैंड इज टेकिंग अल्कोहल जस्ट जिस दिन वो कमाते हैं ठीक है जिस दिन नहीं कमाते मुझे मारते मेरे पैसे ले जाते हैं तो मैंने कहा शुगर तो करनी पड़ेगी तो उसने अपना पर्स निकाला पर्स स्ट्रिंग वाला एंड स्टार्टेड टू कैलकुलेट द कॉइन्स इन फ्रंट ऑफ मी कितने पैसे लगेंगे 30 रुपीज 20 रुपीज वट एवर देन आई थॉट आई एम एडल्ट फिजिशियन मुझे टाइप 1 से क्या मतलब इन नेक्स्ट कैंप वी गॉट सेम type of patients another 10 children with same story similar story around that and then gradually the journey started in 20 years back and now we are with all support of LFAC Diabetes India Breakthrough IDF we are supporting more than 500 such type of rural underprivileged children in our half of the Rajasthan and part of the Madhya Pradesh. Thanks to Diabetes India, this is story everybody knows in last 10 years. The numbers are increased from 70,000 to 3 lakh children below 20 years. This is IDF Atlas 2025. More than that, regional prevalence is different in India. In every part, the prevalence is different, whether it's Karnataka, Chennai, Haryana, these are states. These are the data from our center. 50 to 70% from rural to semi-urban area. 50 to 70% from lower class and middle class, and these are numbers supporting more than 500 this time. Sweet data we are sending every 6 months to Sweet this registry, and unfortunately HbA1c is not very good control in spite of getting all support from all NGOs. Still it is around 9 8.5, not less than 8.5 but some children are doing very well after this education part. T1D is rising, growing 6.7% each year, even more than type 2. But we all are always discussing about type 1, type 2. And life expectancy in India is around 34 years in T1D, less than even Sri Lanka. So this is a big issue for our country. 9,90,000 total numbers are there in type 1. And 42 years lost, average 10-year-old diagnosed T1D lost 42 years in their life. Insulin and test strips is already Dr. Partha in his first slide told that insulin test strips are most important part. If you can provide insulin and test strip, you can restore 20 years, that's 70 years restored with insulin and test strips and 3 years with glucometers. This typical Barbie doll in type 1 diabetic in UK and USA, this carrying CGM, insulin pump, awareness, outfit and accessories in their countries. And unfortunately in our country, these are the type 1 diabetic children. We are facing each and every clinic, small child, poor family, blood glucose 300, 400, 500 or high, and unaffordable, uneducated. This is same story in every part of the country. These are photographs from our center, taken the consent from all these parents. It is invisible disease. Why undiagnosed? Because the public awareness gap, healthcare provider knowledge, rural infrastructure is very poor. Rural, 66% people are living in rural, 33% are living in urban area. Low awareness among the public. We are doing a lot of activities like learn from the Udan also, doing camps every year, socio-academic program, that is those program in last many years. And for that, We are trying to connect with our politicians in our state also, in our quota also, where Lok Sabha speaker is there and lot of politicians are there. So we try to connect them, and they are helping and they are reaching the voice to the national level also. Barriers to effective care healthcare system, we all know about that. Insulin access, specialty shortage, policy integration. Technology is very important, but definitely we are not able to provide this, especially CGM and insulin pumps technology. If we are providing this technology, we can restore many more years for these T1D children's. Barriers in technology, affordability, rural availability, insurance gap, technical support. Of course, research and investigations are not very good in India. Now, gradually, people are doing research work in type 1 diabetes. Policy and future direction need to dedicated T1D policies in India. This is a paper by Dr. V. Mohan sir. So we need a lot of things for this policy. Hope and progress, the future of children in type 1 diabetes in India. Every child diagnosed with T1D in India deserve access to life-saving insulin, essential monitoring, supplies, comprehensive education and advanced technology and transport daily management. मैं जब भी आता हूँ तो मुझे एक शेर याद आता है, उसमें डॉक्टर अर्चना शारदा इज नॉट हियर, सभी लोग डॉक्टर उड़ान भी उसमें एक शब्द है, कहते हैं कि जिंदगी की असली उड़ान अभी बाकी है, जिंदगी की असली उड़ान अभी बाकी है, जिंदगी के कई इम्तिहान अभी बाकी हैं, अभी तो नापी है चंद मुट्ठी भर जिंदगी हमने, अभी तो सारा आसमान बाकी है. तो शायद उसी उम्मीद से मैं ये आगे बढ़ रहा हूँ कि वी आर ट्राइंग टू मीट एंड वी आर ट्राइंग टू कनेक्ट विद नेशनल लीडर्स दैट in India there are two health policies. One of them is NCD, another is RBSK. But type 1 diabetes are neither in NCD nor in RBSK. We are trying to requesting them to at least this should be there in either NCD or RBSK. Type 2 is there in NCD, but not type 1. Our aim is to include this disease in RBSK. There are a lot of voices from various states, Gujarat, West Bengal, Rajasthan, Karnataka, UP, MP, Chandigarh. A lot of NGOs and states are working for this. And in Rajasthan also, Michelle Madhuhari started last year. Every district T1D clinic was started. And this 4 or 5 days back in Maharashtra also, one of the MPs in parliament has told about the type 1 diabetes. This is the photograph of Gujarat Chief Minister and our President of India, Prime Minister of India. So these are the portrait made by type 1 diabetes. These are legends of T1D of our country. T1D working, diabetes India, breakthrough, LFAC, RSSDI, all. As per Dr. Partha, they are using pump and CGM. CGM is almost in 90% and 100% pump in 90%. HbA1c is 6.57. But in our country, life expectancy is 34. But we are hoping. Still, we are in last 5-10 years, we are getting lot of work and lot of things are doing. So these are the statement of Dr. Partha. Dr. Partha, your statement is I committing. Indian economy is stronger than UK. So many shoulders pushing, wheel will definitely turn. You are pushing all these NGOs and societies. And Dr. Banshi told last month, we will change the data of T1D index in next decade. And through breakthrough, the road ahead for type 1 diabetes is filled with hope, and each step forward bringing us closer to a cure, hopefully. And India will show the world where to go in terms of new model of healthcare. It's a statement by Dr. Neeti Paul, IDA President-elect. So together we can change the story of people living with type 1 diabetes in India. हम होंगे कामयाब एक दिन. Thank you very much. Thank you.